Hi, everyone. Welcome back yet again with another interesting discussion, a session with the doctor series sessions that we've been doing regularly. And this time, we have Dr. Neethu Thambi with us. Thank you, doctor, for coming online and talking to our audience.
Hello. Hi.
So Dr. Neethu Thambi is the Senior Specialist Pulmonology at the Renai Medicity, the multi-speciality hospital at Cochin in Kerala. And I thought it's important that we get Dr. Neethu on board to speak to all of you audience regarding the lung health, the respiratory health. I think the health of the lung, the respiratory system has assumed tremendous significance, especially in the recent times after the whole hangama around COVID and the things that I remember people talking is that, during the Omicron wave, the lung involvement is comparatively much lesser as compared to Delta. So all these discussions, we happen to hear it in the newspaper, and these are big things. SpO2 became a common word it became a parlance among a lot of people, right? And oxygen saturation, is it below 90? Is it below 95? These are all the things that we were tracking, right? So the lung health has assumed significance, especially in the wake of pandemic. And I thought it's appropriate that we bring in somebody who is actually works in the with the COVID patients and have had experience working with them with these kind of issues. She's also an allergy specialist. And so Dr. Neethu is also involved with the post-COVID aspects of health, involving what exercises, how much, how to go about, and a whole lot of things. So I think this is a very relevant discussion that we are going through here. And we have a series of questions here for you, Dr. Neethu. So thank you once again for talking to us. My first question to you is that, I earlier mentioned that in the recent times, the respiratory health has become assumed significance in the wake of the pandemic. Why are we suddenly talking about lung health all of a sudden?
Okay. So I think the sudden twist towards talking about lung health might be because once we came into the COVID era, and a lot of people started getting COVID, and we came to know that those people who are affected, whose lung are getting affected by COVID, are the ones who are getting a severe disease. So I think that is the problem that has brought lung health out into the forefront. Now we've been talking about lung health for years now, and about allergies and about how our lifestyle is bringing about so much change in our health and in lung health per se, and about smoking, about pollution. But then I think the sudden interest in lung health today is because of COVID and how lung health reflects in your course, course of the disease. All right.
Right. So what is this SpO2 oxygen saturation that people are talking about, and why is it important?
Okay, I guess that's very interesting. So SpO2 is saturation of oxygen. So you are measuring the saturation of oxygen in your blood, or the oxygen carrying capacity of your blood. So you have, I'm sure most of you know that there are red blood cells in the blood that gives it the red color. And there is a pigment called hemoglobin, which is the main oxygen carrying factor inside the blood, which gives it the red color, right? So each of these hemoglobin molecule can carry about 4 molecules of oxygen. So that is its saturation, or that is its capacity. So this oxygen is acquired from the lungs. So your blood is transported to the lung, and from the lungs through small tiny air sacs called alveoli, the air from the atmosphere is filtered, and only the oxygen part diffuses into the lung. The hemoglobin catches hold of this oxygen and transport it to all of your organs, where it is utilized for, for each of your organ to function. You need oxygen. You need oxygen for your heart to beat, for your brain to function, right? So if everything is okay with your lungs, if your lung is working normally, then all of the hemoglobin particles that goes into the lung will come out saturated with the oxygen 100%, right? So the top measure of saturation of oxygen is 100%. So when you put the pulse oximeter on your finger, if you're a normal person having a normal lung, your saturation would be somewhere between 98 to 100%. That is a normal lung. So if there's something wrong going on in the lungs, either you're not getting enough oxygen from the atmosphere, or your lung is unable to process that oxygen and put it into the blood, or your circulation is not working. If one of these problems are going on, then your saturation would drop below this 98 to 100. Okay. So your body can compensate, a lot of things. So if it happens slowly over time, gradually, in case you have a lung disease, which is making your your lungs efficiency go down, then you might be able to tolerate this lack of oxygen, which is what happens in COPD patients. So there are people who will come up to you and say, yeah, my normal oxygen saturation is around 92%, right? So they've been living in an oxygen deficit for a long time. So that is probably not affecting them much. But what happens in COVID is that the virus goes to your lungs and attacks a lot of cells at the same time, making them incapable of taking oxygen from the atmosphere and giving it to your blood, which means your oxygen saturation would go down very rapidly. And your body is not used to living in that kind of a oxygen deprived situation, and you start becoming sick. You start breathing very fast, which requires a lot of energy. You start tiring out, and all of your organs in turn getting less oxygen. So basically, SpO2 or saturation of oxygen is measuring indirectly the capacity of your lung to bring oxygen into your blood. So how they do it is basically based on photometry. You must have heard that everything around you absorbs certain colors and reflects certain colors, right? So they are sending out an infrared radiation from the pulse oximeter, and this goes into your the thin skin under your nail, and a part of it is absorbed. Part of that spectrum of light is absorbed by your hemoglobin, and the rest of it is left out, passes through your finger back into the probe. This is measured, and this tells you your oxygen saturation.
Very interesting. So, so basically, this reduction in the ability to carry oxygen leads to something called hypoxia, which is basically reduced oxygen, leading to exertional tiredness, dyspnea, weakness, and inability to breathe and all that, which is basically what is going to cause problem for somebody who's not used to that kind of an issue, right? So, very interestingly, the kind of the example that we tell people is that our lung is like a soda maker. So it's basically like you do a one tish and the oxygen gets filled in, right? Something very similar. It's just that the blood is getting flushed with oxygen every time it goes through the lung and comes out, and the heart pumps it. So thank you for bringing in technical aspect of all that, how it goes ahead and the significance of it. So you also mentioned about COPD patients and people who already have a lung which is already impacted and all that. So how does smoking? We all know that smoking affects lung. So how does it happen? How does it impact these alveoli, and how does it impact lungs' ability to absorb these oxygen? Why does it go down to this 90, 92 levels because of this smoking and other things?
So smoking affects a lot of your organs. Now,
your voice is a little feeble.
Okay, sorry. Smoking affects a lot of your organs, many of your organs in the body, but then I will, limit the discussion to lung. So the smoke that comes out from your cigarette is a mixture. It's a cocktail of a lot of things, some of which I would say the least harmful of which is the carbon particle that the people show in the movie theaters. The thing that comes out. Yeah. So that is causing a lot of problems. But then the rest of the stuff, there are about 7,000 known chemicals in cigarette smoke, 70 of which are known carcinogens. Carcinogens are cancer causing chemicals which has the potential to go into your cell, alter your DNA, and make it prone to turning into a cancerous tumorous growth, right? So this is just one of the effects of cigarette smoke. So the main the effect that you want is from nicotine is just one of the many components of cigarette smoke, and the rest of all of this is being directly inhaled into your lungs, and it goes through so the lung has a tubule part, a tube part, and a sponge part, right? So the tube parts are what conducts air from outside into your lungs, and the sponge part is what takes the oxygen from the tubes and puts it into your blood, just like we discussed. So smoking causes damage in both of these areas. So it goes on, and it causes a lot of impurities to get settled into your lungs and into your tubules, so that your tubules are not able to conduct air properly into your lungs. So they get constricted. So if you're thinking of a tube which has this much diameter, for a smoker, it might be only this much. Okay. And along with that, it causes a lot of mucus production, which is why people who are smokers, they keep coughing, they keep spitting out sputum every now and then. So you call it the smoker's cough, a very innocuous term, but then the thing is, it is actually causing your lung tubes to shrink a little and produce a lot of sputum. And at any time, when you get a disease or when you get an allergen or whatever causes your tubules to shrink a little more, you start getting breathless. All right. And so we also talked about the sponge part of the lung. So the chemicals that come from the smoke will also affect these sponge parts. So if you look at a sponge, it has very tiny sacs, right? And if you think about the science that you've learned before, tiny small sacs and a large number of them would have a greater surface area than a single large sac, right? Yeah. So what these chemicals do is they go and break down the walls between these tiny alveolar sacs and make them into a bigger, larger balloon-like sac. Okay. This is less elastic, right? And it also has lesser surface area. Lesser surface area. So the oxygen that is coming from your atmosphere has lesser surface area to diffuse into your lung. Blood, yeah. Okay. And this is also not very distensible. So people feel that they are not able to take adequate amount of air into their lung. They feel that, they feel air hunger. They feel that, okay, I'm not getting enough air to breathe or enough air to feel comfortable, because their lungs are obviously stiffer and they cannot move much, right? Okay, so these are just some of the effects. This is how a COPD patient or a chronic obstructive pulmonary disease develops in a patient who is smoking. Okay. And this is just the first part, right? People who are chronic smokers and who smoke very heavily would have a very heavy load of carcinogens or cancer-causing chemicals in their lung, and not just their lung. This can also cause cancer in their oral cavity or mouth, lips, in their throat, right down to their lungs. Okay, and this can cause lung cancer. And lung cancer is one of the most difficult cancers to treat, because obviously the person who has had a COPD is used to living with suboptimal lung function for a long time. And unless the tumor gets that big that it is causing a lot of trouble to them, they would not even notice. So usually they get to know about this lung growth very late, much later than most other cancers. It will not show up as a swelling like other cancers. So you usually detect it late after it has spread to other organs, and it becomes very difficult to treat. So that was just the COPD and the lung cancer part of it. It can cause cancer in a lot of other places, including bladder tumors, and and it can also cause coronary artery disease. There are a lot of things that goes on in the chemicals that comes from smoke.
Right. So this takes us to the bad.
Sorry. Yeah, I didn't tell you how the oxygen saturation decreases in these people. So that is.
Yeah. So when you say that when the sac becomes larger, the surface area is lesser, the ability to diffuse oxygen also becomes lesser. So, I mean, yeah, we got that. And that was well understood with your explanation. So, yeah. We're talking about the bad lifestyle and the related lung health issues. So COPD is one, and related smoking related things you already mentioned. Are there any other issues which comes along with, and what are they?
So it's mostly more than lifestyle, it's the changes in lifestyle that has brought about these diseases. So one of the main, this is a lifestyle choice, I would say, and it has been there for a long time. Some of the changes that has been happening recently would be increase in carbon emissions that we all know. And environmental smoke or smoke from diesel exhaust fumes and occupational exposure to certain chemicals, all of these can also cause COPD-like diseases. Some of them can cause COPD, and some of them can also cause diseases like interstitial lung diseases, which are also a certain kind of, let's say, restrictive lung disease where you cannot breathe properly and your lung starts becoming stiffer over time, and oxygen saturation in your blood decreases. Another disease which has been there since much, which everybody knows about, but which has been increasing rapidly in the younger generation is allergy. Okay, so allergy is basically a kind of an abnormal reaction of your body to a substance which is there in the environment. So nowadays we are more urbanized, right? And our kids are living mostly indoors. Concerned parents don't let them go out and play in the in the field with the animals and in all the dirt and all that. So this kind of limits their exposure to a lot of biological material which we've been used to since time immemorial. We've been used to them, and nowadays the kids are not exposed to them, and they start developing a sort of intolerance to these biological substances, right? And later in their lives, when they are newly exposed to these things, they react abnormally and in a very rapid and in a very loud manner, and this becomes an allergy, right? So this is called the hygiene hypothesis. When the kids are lesser and lesser exposed to infections and biological materials, they become more prone to allergy. This is a kind of trade-off because back in those days, we had a lot of infections and we had a lot of child mortality because of infections. But then, yeah, because all of those are decreased.
Acquired immunity also increases because of having exposed to these kind of pathogens and allergens.
So exposure to pathogens is much lesser, especially in single child families. If you have 3 or 4 kids in the family, then obviously one of them will catch an infection and all of them will develop an immunity to it. So that is not happening. And we have much lesser number of animals living around us and contact with them is less. So if you live in a no pet family, then again, your exposure to a lot of natural antigens is decreased, which can increase your allergenic potential, right? And so yeah, keeping a pet dog might be a good idea in this context to develop a tolerance to allergens, but obviously you cannot ask them to go out and play with, get diseases just for the sake of not having allergy.
Yeah, I understand. So what about asthma?
Yeah, asthma and allergy are all kind of very related diseases. Okay? They lie in the same spectrum. So people who have allergy can develop asthma in a later life. There are non-allergenic asthmas also. There are cardiac asthmas and even other kind of asthmas. But then most of the asthma that you see in kids and in adults are usually related to allergies. So again, the same kind of same rule applies here. The less you're exposed to these kind of antigens, the less tolerance you have, and there is more chance for you to develop asthma. And there are a lot of other inorganic materials like smoke and dust that you're exposed to and which pollution. Yeah, which can also. And another factor is global warming. So you would have maybe back in your school days, you would have studied in geography about tree lines or about how vegetation changes with the climate, with the what are those latitudes, longitude, right? So and as you go up a mountain, the vegetation changes, right?
Yeah.
So because we are getting warmer, our climate is getting warmer, the tree lines are shifting up and the summers are becoming longer. So summers are usually the most pollen intense season, right? And these seasons are getting prolonged, and there is more. There are more pollen being produced by these trees because of a warmer climate, right? And there is a larger pollen load in the environment. And
interesting,
And another problem could be that some of, especially in Kerala, we are a very humid climate, right? And people say that when you're exposed to humidity or when you're exposed to colder climate or, with change in climate, they get these problems, right? One of the factors with humidity is that it increases the allergenic potential of these biological factors. So I've seen a lot of immigrants say they would go to Gulf and they have no problem. They come back to Kerala, then they start getting all these allergies. One of the causes could be that they're opening up their homes after coming back after a long time and they're getting exposed to all these allergens. Another factor is obviously the humidity.
Humidity, very interesting. I wanted to talk about one more thing, pneumonia, which is again yet another thing which was spoken about especially during the Delta wave. How is that coming in, and what exactly is that? And
So pneumonia is any infection in the lung, right? It could be bacterial, viral, or fungal. So anything that happens inside the lung and causes the alveolar sacs, which I mentioned earlier, which causes those sacs to fill up with something is called a pneumonia. What we are seeing in the COVID wave is mostly viral pneumonia, and viral pneumonia can lead to a decrease in the local, what can we say, local defenses, which can predispose you to develop a secondary bacterial infection. Yeah, bacterial and fungal infections. We are seeing a lot of fungal, let's say, aspergillus. Yeah, mucormycosis is much rarer, but then there is another entity called aspergillus. Now, aspergillosis was a very rare disease pre-COVID, but then nowadays we are seeing so many people with aspergillosis that it has become sort of a routine thing, almost like like you're treating asthma, you're also treating aspergillosis.
Could it also be because the mask that we are using, we probably reuse it, keep it aside, and it's not dried out, or sometimes reuse it without proper hygiene? Does that cause fungal infection directly?
That might be very rare because all of these fungal spores, they are ubiquitous. If you search for Aspergillus fumigatus and where it is found, you will see that it will be found almost everywhere in soil, in household, in damp patches. So there are other fungi also which are found in the damp patches on the walls, maybe under the sinks. We live in such a humid area that fungus. This is like the perfect condition for fungus to grow.
They live with us
everywhere. Yeah. So you've obviously been exposed to the fungus. So it's not about you not being exposed before and being exposed now. It is about your lung defenses going down. Right. So you get COVID and your lung is not in a position to defend against. Basically, fungi are very difficult. It is very difficult for a fungi to go and produce a pneumonia. But then your lung is so badly affected and it has no defenses that even such a small pathogen, such a weak pathogen is causing pneumonia for you.
Right. So post-COVID infection, once having recuperated, I want to ask you to talk about two things. What is the general routine? I've seen people. So typically what I've seen is that when clients come to us and speak to us, until COVID, they have least bothered about their health, no exercise, not even doing any sort of physical activity. But when they get this COVID infection is when they get all scared and it's like, now I'm going to become healthy. I'm going to do all exercise. As soon as they test negative on an RT-PCR, they start thinking of exercise. So I tell them that please don't go ahead and do this. I think it's better that we hear from the horse's mouth as a specialist, having experience and having worked with so much of COVID patients. What would you suggest should the exercise routine be, and how should one go ahead with it?
So I think that's a very, very good question at this in this time, because you see, just like you said, a lot of people would say that they've been putting off exercising till, because of the COVID pandemic or because of whatever reason they had. And then suddenly now they've realized that they have to get healthy and they start, going out there and going to the gym. And now they're not afraid of COVID also because they've already got it. So what cardiologists say and what everybody advises is that at least for 3 to 4 weeks, do not do any kind of strenuous exercises. So you can do your normal activities at home. You can do whatever you've been doing at home inside the home. Just to keep yourself lightly active. You don't have to take bed rest, right? So a lot of people just think of this as a disease where you need a lot of bed rest. There is no need for bed rest. You can do all your normal activities so that you don't take such a long break from your routines that even doing the routines become a little strenuous for you. So don't do that. You can do all your routine work. But then when you are thinking about newly starting an exercise or going out there and working out, wait for at least 3 to 4 weeks solid. And when you start, you have to start slow. That is imperative. Even if you've never had COVID, it is imperative that you start slow and then slowly step up, right? So we say 3 to 4 weeks, please don't do any exercise. And after 4 weeks, start in a graded manner. And then over 6 to 12 weeks, you can achieve your target heart rate. You know what your target heart rate would be? 220 minus your age, right? So within these 12 weeks, you should limit yourself to at least below 60% of your target heart rate. Okay, and
So
only after that,
60% of 220 minus age is the maximum permissible heart rate for at least 12 weeks.
12 weeks, yes,
Yeah.
that would be the
I
safe.
wanted to capital bold underline that point that you just mentioned. Yeah, sorry, go on.
Another reason for anybody starting to newly exercise in this age, I would say do this, because you don't know how many of you've got subclinical COVID infections. And we've seen so many cases where there are a lot of young MIs happening these days.
I know.
And a lot of people don't know that they've ever had COVID, or they would not test. Even if they got the symptoms, they would just stay quiet and they would not test. And as soon as the 7 days are up, they just start doing all their routines, or like you said, suddenly change their routine and start to become healthy. And all these can actually endanger your life, because a lot of people can have silent heart diseases, right? Silent heart diseases, which have been either you could have had a family history, or you may not have had a family history at all, because see, our parents had a different lifestyle and they lived a different life from us. So even if you had a tendency to heart disease, it may not have manifested in your previous generation, but due to the person you've been, what you've been eating and what you've been doing, it can happen in you, right? You might have the genetic a genetic predisposition to have it, and you might be the first one in your family tree to develop it. You have to keep that in mind, right? And so you have to always start slowly and get your target rate or whatever, because exercising and maintaining a healthy lifestyle is not something that should be done like a crash diet. It should be slow to build up, and it should be a lifestyle change. It should be sustained. So when you're thinking of doing spurts of exercises for 10 days, you go and run 3 or 4 kilometers, and then for 2 months you don't do anything. These kind of things can actually stress you out, and rather than doing good, it can actually do more harm to you. COVID is a disease where you develop a thrombotic tendency. There is a chance for your blood to get clotted. So if you have a mild disease, heart disease, which has not been detected yet, right, and one of these clots can go there, and if you already have a compromised circulation, it can completely cut off your circulation. It can lead to a heart attack, and these emboli can go into your brain. It can result in a stroke. We've been seeing so many young strokes these days.
Right? Can cause pulmonary embolism also, right?
Pulmonary embolism. So pulmonary embolism, again, people at least get to your OPD, right, with falling saturation or dyspnea. But then in CVA or myocardial infarction, if it is a massive one, you don't even have a chance to survive. So it is always best to start in a slow manner, build up, and keep it as a lifestyle. And it's always best if you have let's say you already have a family history or you have risk factors. It's always better to get a medical checkup done before you start doing all these strenuous exercises, especially if you've had COVID.
Yeah. So that's one thing that I keep saying, that post 40 years of age, especially, or after 35 or 40 years of age, it is extremely important, especially for the Indians, the South Asians who have a very huge predisposition to these kind of diseases, to do some sort of test. In fact, we spend a lot more money on our yearly maintenance of our car. Perhaps we might not spend so much to actually do that test. Probably an executive health checkup might cost 10 to 15,000, and it might save not just you, but your family also. Right, and that's actually very well pointed out, doctor. So I just have this last question to ask you. This is regarding the breathing exercises, and I'm asking this in the light of this thing. We are all living a social media life, right, wherein we don't want our tummy to be shown. We walk around and we will tap our tummy. We say Malayalam air bidicchu nadakka. We all do that. I've done that. I'm sure a lot of people have done that. We've been there, done it. So, but eventually when we tuck it in, we do this upper chest breathing, which is not involving the entire lower portion. It's not, the diaphragm is not going down, diaphragm is not engaged and all that. It kind of brings down the lung capacity and also. So importance of breathing exercises, how to do some sort of breathing exercises, and post-COVID should one do, or how to go about doing that? Could you throw some light on that? That's the last question that I have for you.
All right. So regarding breathing exercises, now, if you're a normal, healthy person, like you, I think when you go to a gym, no, and you say, I want to build a six-pack, they are not going to let you do abs alone, right? They exercise your entire body. They ask you to do some cardio. They ask you to work out all your big muscle groups. And then along with that, you have to do your abs and slowly build it up. So just like that, if you're a normal, healthy person, then doing breathing exercises alone is not going to strengthen your heart, because, strengthen your lungs. Because when you are undertaking, the basic reason why we are building up our health is so that we can tolerate stress. Now, stress in the form of physical stress or emotional stress or a disease, right? Which is why we are trying to maintain a healthy body. So when there is a stress, the heart and lungs work as a unit. So it's a cardiopulmonary unit. So if your heart is not strong, even if your lung is very strong, this is not going to work out. So when you're a normal, healthy person, you have to do your cardio 3 days a week, and your exercise, your muscle toning exercises, everything. Along with that, obviously, when you're panting and when you're doing a cardio exercise, you are exercising your lungs. And then apart from that, if you have lung disease, or if you have COPD or bronchiectasis, asthma, there are certain breathing exercises that we tell you to do, and they are targeted. Basically, they are aimed at letting you breathe more easily and letting you control your disease, right? So in COPD, we encourage people with COPD or asthma spend a lot of their calories in working for breathing, right? There is a term called work of breathing. So you're spending a lot of, yeah, which is why they get very thin, because they are spending a lot of calories on the on merely existing or just breathing, right? So these exercises are aimed at reducing this work of breathing and allowing them to breathe more effectively. So there are diaphragmatic breathing exercises, wherein you hold a hand on your chest and on your tummy, and then mindfully you let your tummy breathe, or tummy come out further than your chest. Okay, so that exercises your main breathing muscle, which is the diaphragm. And there are techniques called pursed lip breathing, wherein you ask them to breathe through your nose and then exhale slowly through your mouth while pursing your lips. This again lets them control their breathing rate, and lets them, there is one more effect to calming yourself down, and also opening up their respiratory tubules better. And this also prevents air from getting stuck in their huge balloon like alveoli, and helps it to ventilate better. Okay. Then there are other techniques called coordinated breathing, wherein you breathe through your nose, hold your breath in, and then breathe out through your mouth slowly. So all of these techniques, I think you'll see in yoga, in what is that? And the breathing exercises that you do in yoga, right? So
I understood it about, the Vilom and all that.
yeah, those kind of things. So, and then so these are the specific exercises that you give a patient who has a respiratory disease. So if you're a normal, healthy person, doing these exercises are not going to harm you, but then that alone will not help you strengthen your lungs. You have to do the whole thing. There is a shortcut to it.
Absolutely. So this is something that we always tell our clients and viewers, that when you look at exercises, there is weight training, there is cardiovascular exercises, there is also yoga, breathing exercises. A healthy person without having any physical manifestations of medical conditions should do a mix of all the three. Of course, if there is rheumatoid arthritis, don't go run a marathon. If there is an inguinal hernia, don't go and do a deadlift and lift a lot of weight. Apply all that common sense. But then if otherwise you are healthy physically and within permissible physical conditions, mix up all sort of exercises to get the ideal sense of health, wellness, and fitness. And I'm so glad that you ended the discussion on that note. Thanks a ton, Dr. Neethu, for talking to our audience. Once again, this is Dr. Neethu Thambi. She's the senior specialist pulmonology at the Renai Medicity. She's a specialist having worked in the past the entire pandemic time, she's worked with an umpteen number of COVID clients and patients, and including their post-rehabilitation complications, so on and so forth. She's also an allergy specialist. Thanks a ton again. You are listening to NuvoVivo's doctor series of discussions. NuvoVivo is an online health and wellness company. We deal with lifestyle diseases management. We help people become healthy and fit, combining the understanding of the medical science and bringing in the fitness, which is the curative, preventive side of the story, fitness exercises and clinical nutrition. Bring all that together to not just look younger, but also to be healthy and live healthy, lives to stay safe, young, and fit. That's what we do. So thank you for watching this session, and we'll be back again with yet another interesting, similar session in the doctor series of interviews. Thank you. And thank you, Dr. Neethu. Thank you.
Thank you.